Alright, guys, I thought today is very important to explain a specific issue that I think is very much misunderstood around the world, and that is which is really the best model. People talk about the Wuhan, China model, the South Korea model, and so on and so forth, right? But if you really look at the issue very carefully, what you realize is that in order for you to understand which is the best model, you have to first identify where is a certain country, country X, in the spectrum of epidemic outbreak. So this is where I'm partly grateful to one of the economists, journalists in India, who tried to explain the response of New Delhi to the COVID-19 crisis over the past few months. And he talked about 4 different stages. So the first 2 stages are actually the preventative stages or prevention phases, whereby you make sure that there's no en masse, large-scale intra-community transmission, right? So the first stage is you impose very rigorous and very effective monitoring of passengers and individuals coming from the hotspots, or if things get really out of control and if a certain threshold of threat has been passed, then you impose restrictions altogether. So countries like Taiwan and Singapore are one of the best models here. These are the countries who imposed very strict travel restrictions and had very effective monitoring mechanisms for passengers coming from Wuhan earlier in January this year, and later on there was a total ban on people coming from the hotspots, including entire China at some point. No, so these are countries who have been very effective through monitoring, proactive monitoring, and very strict imposition of restrictions. The second stage is where an infected person actually already gets in, and that person reports after a few days to a local hospital. The person is tested positive. So in that case, what you're really focusing on is proactive usage of contact tracing. Who are the persons, or who are the people that this infected patient 0 or patient 1 has met over the past few days or more than a week? No? So what you have there is more targeted quarantines, or in the case of Singapore, they established different quarantine centers and they placed all the people who could have been potentially or were confirmed to be infected there. And in that way, you avoid intra-community transmission on a large scale. No, so this is the stage 1 and 2, which are very crucial, and Taiwan and Singapore are very good models. Some would even say that Vietnam is one of the effective models there, because in the case of Vietnam, they have avoided the necessity for a lockdown of major city. What they had was a targeted quarantine in a northern village of around 10,000 people, where there were suspicions of transmission on a large scale. No, so you had targeted quarantines there to make sure that the intra-community transmission doesn't happen in numbers like tens of thousands or millions for that matter, right? So that's stage 1 and 2, and Singapore and Taiwan and Hong Kong and Vietnam are seen as some of the best models. In fact, I really suggest you read this New York Times op-ed by 2 experts, Benjamin Collin and Wei Wen Lim. They've contained the coronavirus. Here's how. So this is on New York Times op-ed, which I think is very helpful for you to understand why certain countries were very effective in terms of preventative measures. No. Now, the third stage is where you already have intra-community transmission on a large scale, no? And this is where the South Korea model comes in, because in the case of South Korea, they failed the preventative stage. There was a certain controversial church that inadvertently facilitated this intra-community transmission, but the South Korean government did not resort to large-scale lockdowns. In fact, there were no lockdowns of any major city, including the city which was the epicenter of the outbreak earlier this year. What the South Korean government did was mass testing, drive-through testing facilities, which at that point was unheard of anywhere in the world. And you had very proactive, cutting-edge deployment of technology to make sure that the public gets the information, the public is reassured, people can inform the government through big data what is the situation, what is the latest situation with them. So you had big data, transparent, highly efficient and effective and accountable way of governance to deal with it without lockdown. And South Korea is seen as the leading model, especially for democracy, because China also reached that level. But in the case of China, they had to shutter the economy, not only in Wuhan, they're Detroit in many ways, but in the Hubei province. So 50 million people faced economic shutdown and massive restrictions on movement. And by the way, there were fines, huge fines, based on some reports, up to 10 years in jail or even more, life sentence for some people who were accused of violating the quarantine, and found guilty, you will face very strict punishment. So I think the China Wuhan model or Hubei model may not be very appropriate for more democratic open societies like ours, for instance. So that's where the South Korean model is really helpful. So not in the preventative or prevention phase, but more in the containment without lockdown or shuttering the economy or severely impacting the economy phase, right? And they did that through mass testing and cutting-edge, proactive public information campaign. No, the fourth stage is unfortunately like what we have seen in places like Italy and increasingly in Spain, among others, whereby you have en masse, massive intra-community transmission, contact tracing becomes almost impossible. There was lockdown, but it was haphazard, half-hearted, not properly coordinated. We see countries that are more decentralized, like Italy, like United States, have been really struggling with this because of the lack of proper coordination and lack of an effective, sustained, decisive lockdown to make sure that the epidemic is under control, and it at the earlier stages before, and you flatten the curve as soon as possible before there's high level of fatalities. Unfortunately, Italy entered that phase. But if we look at Italy, they're sustaining the lockdown right now, which has been increasingly tightened, even though they seem to have passed the peak. We don't know for sure, but that's one suggestion, looking at the latest numbers coming in. So in the fourth phase, what you really need is decisive lockdown. And I think in places like the Philippines, whereby mass testing a la South Korea has been ruled out or has not been possible for many reasons. Perhaps what we have to look at is the case of Italy, where you need very effective lockdown, sustained lockdown, and weeks of that, and sometimes probably more than a month. And I think this is very important as we here in the Philippines, for instance, discuss the possibility of extending our lockdown beyond 1 month. And I think what really got my attention was what Andrew Cuomo, the governor of New York, suggested in a podcast interview with New York Times, when he talked about the possibility of intermittent lockdowns. Because unless we have reliable mass-produced vaccines, which may not come until quarter 2 Q2 2021, and really reliable, affordable treatment, then it's very hard to look at the one-off lockdown and then we are okay with that. Unfortunately, that's not how it works, and this is an interconnected world. So maybe you solve it in your country, once you open up, it can come from another country, and that's what we're going to discuss, the second wave, in my other video discussions. Now, if you want to have a more detailed analysis of this, you can look at my article for the National Interest think tank in Washington, D.C. These are the known knowns about the coronavirus impact. So this was published March 28, where I look at these 4 different stages and what are the best models depending on that, right? Okay, thank you very much.